Hello, this is Ravi Tolwani, and I'd like to describe to you how you can input patient history by voice to generate a medical chart. So I'm going to go ahead and get started by clicking on Start Recording Client Discussion in Exam Room and illustrate to you a conversation between the vet tech and also the client, and then stop the recording. I have a 6-week-old German Shepherd with intermittent vomiting and diarrhea. The diarrhea is hemorrhagic at times, and the patient is feeling lethargic. So once I click Stop Recording, the actual exam room conversation will appear in text form, as you can see here. The next thing to do is to click on Generate Potential Differentials. So I've clicked on that. This will take approximately 20 seconds or so. Then here we have the potential differentials. Parvovirus, gastrointestinal infection, or dietary indiscretion. One can click on the individual differentials and get more information about these differentials. The next step is to choose the most appropriate differential. So I'm going to say parvovirus and gastrointestinal problems. I can go ahead and change that if you want to dietary indiscretion. And then I click to get medical chart. Now the AI tool has chosen the top two, parvovirus and dietary indiscretion, what we have chosen to get further information on. And once again, this will take about 20-30 seconds. The reason it takes a few seconds is that it has to connect to the large language models being used in the background and also the reference material that are being used. Here we have the patient medical record. It's a 6-week-old German Shepherd. Here's the patient history. Here are the differentials that you chose to be the most relevant. The selected diagnosis is listed here, and so is the treatment plan. Now, this is an editable document, so I'm going to go ahead and add here. Please come back for recheck in 2 weeks. I can also delete and modify any of these things, and then put my email address here and email the report to me. Now, the intent of this tool is to use this as a productivity tool for the veterinarian. So what works best is if you take your mobile device or tablet device into the exam room, have a conversation between the client and the veterinary technician, generate a potential differential list, choose the list of differentials, and then provide that to the veterinarian before she walks into the client room. This obviously will facilitate exams and also medical charting. Thank you for listening.